Welcome back to The Blend. Let 2018 be the year you take control of your life. Southern Nevada Bariatrics. You can walk you through a life-changing surgery that can make this year a new year for you.
That's right. Here with more insight into the procedure is Dr. Mustafa Ahmed, along with Maritza, who's the practice manager for Southern Nevada Bariatrics, as well as a patient herself. Good morning to you both.
Good morning. How are you?
Doing very well.
Well, we're doing well. We're glad to talk to you this morning.
Yeah.
As the year winds down and we approach 2018, why is this a good time for people to consider bariatric surgery?
Well, traditionally, the beginning of the new year is a time that people think about losing weight.
Oh, yes.
They have resolutions. They say, we've got to lose weight in 2018. And I do know from experience that patients who have tried exercising and dieting and taking pills, usually over the long term, it does not work. So our practice is a small practice that focuses on the patient. Unlike other practices, I actually know all the patients' names and I see them all the time and I get to know them and I look at all their medical issues and so it's a personal service and they'll be very happy with it because they'll lose all that weight with the exercise with the surgery. Surgery is the only thing that works, and I'm trying to get across to people that dieting and exercise do not work. They don't. The only thing that works is surgery. And so I've got to convince people that if you want to lose the weight and be healthy and get rid of the diabetes, get rid of the high blood pressure, get rid of your back pain, get rid of all the medical issues that lead to the morbidities, including arthritis and so on, depression, having a bad feeling about yourself, can't go to other places because you feel that people will look at you in a certain way, can't go to the gym because you're overweight. All of those things can be ameliorated or fixed by having surgery.
Absolutely, continuing the same cycle.
Absolutely.
If you're not having results from that, it's worth giving another thing a shot.
Yeah.
Maritza, you're practice manager with Southern Nevada Bariatrics.
Yes.
And you're seeing people come in and out with great results. You're considered a low BMI patient.
Correct.
Why did you decide to do this?
Well, I struggle with my weight for years, and I eat healthy. I go to the gym. I'm at the gym 7 times out of the week, and I work out a lot, and it didn't matter what I did, I still couldn't lose the last 20, 30 pounds.
Wow.
So I had the surgery November 6th. I had the sleeve, the gastric sleeve, and so far I lost 23 pounds.
Oh my goodness.
I feel amazing.
You look
feel
amazing.
Absolutely great.
Yeah.
A week after surgery, I was back at work, and I just feel fantastic. And if I had to do it again, I would.
That's fantastic.
Yeah.
I'm sure you're used to dealing with patients too,
I am.
one-on-one, and you're familiar with the reservations that people have
Yes.
about the surgery. What are those?
A lot of patients are scared of, am I going to be hungry after surgery? How am I going to deal with what I eat? And I explain to them, after you have your surgery, there's a certain gland that gets removed that, you're not going to feel that hunger or that thirst. So you have to take care of yourself after surgery. You have to learn how to drink, how to eat.
Yeah.
And, the portions are very small that you start eating. So I have to explain to the patients exactly what to do after surgery for them to be successful and stay healthy. And now that I had the surgery, I understand in detail everything.
Yeah,
so
firsthand.
it's more
Interesting.
personal with the patients now.
And there's the before picture we have on our screen.
Yes.
You've lost 23 pounds, and you're at the beginning of your journey, which is pretty amazing.
Yes.
So
Congratulations.
congratulations on
Thank
that.
you.
So then, what's your goal? I mean, what are you looking to get out of this? What's the result?
In 2018, my goal is to help our patients at Southern Nevada Bariatrics reach their goal. Now that I've had the surgery and I know what it is before and after, I understand it more in detail with the patient and how to actually help them succeed. And it's very intimate now that you sit there with the patient and you know their struggles, you know how they struggle with their weight and not being able to eat healthy, and the exercise and the fitting of the clothes, especially for women. And
Certainly.
so now that I know, it's to help our patients succeed, to help them be better in 2018.
Oh, that's great. And Dr. Ahmed, I hear there is some expansion going on in your practice.
Yes.
The only thing that's expanding, by the way.
So what we're doing in 2018 is we're going to be moving to a new office.
Oh, wow, okay.
And it's going to be a much bigger office. And in addition to the bariatric surgery, we're adding cosmetic surgery. And that's really important because a lot of patients, when they lose their weight, they have a lot of
extra skin.
extra skin.
yeah.
They also not only have that, but they also have areas that they can't quite lose the fat that they wanted to lose. So doing like liposuction, tummy tucks, breast augmentation, those are what we want to concentrate on. And the good thing for me is, since everything is in-house, we're going to be a whole lot cheaper than sending patients over to plastic surgeons or to other people.
It's a one-stop
and
shop.
that's a service. Yes, exactly. So that's really important. But what I want to focus on in 2018 and really tell the patients is that you can control your weight by doing surgery. You can go to the gym as much as you want, you can exercise, you can diet, you can take pills, you can do all those things, but it only works for a very short time, and then the weight comes right back.
It's great having you. Thank you so much.
Thank you.
Congratulations.
Thank you so
That's
much.
fantastic.
Thank you.
Let 2018 be the beginning of a new you. Reserve your seat at a free seminar. You can learn more about Southern Nevada bariatrics. I want to say pediatrics so badly. By calling the number or visit the website on your screen. Southern Nevada Bariatrics, proud sponsor of the Morning Time.
You must be thinking about yourself.
I guess so, yeah.